Hammer, the isolation support leader for the Innovation Response Team, and Noel Ginsberg, Chairman and CEO of Intertech Medical. I'll be talking about why this is so important shortly and a bit about what they're doing as well. But first, an update and the additional actions that we will be taking. Today, we have 591 positive cases in Colorado. To be clear, that's the number of tests that have converted positive. We fully expect that the number of Coloradans who have COVID-19 is in the thousands. So only a fraction of that have been identified. And if you are exhibiting symptoms, you are to self-isolate in your home. You don't have an urgent need to seek out testing on an emergency basis. Whether you have the flu or COVID-19, self-isolate. And if you need medical attention, please seek that medical attention. Around 8 or 9 in 10 people who have COVID-19 do not need additional medical attention. If you do, seek it out. If you don't, self-isolate immediately. For the 591 cases, 58 people are hospitalized in our state from COVID-19. We've had 6 tragic deaths in our state of Colorado, and currently the identified positive cases have reached 29 counties. We fully expect that it will reach all 64 counties. We've tested over 5,000 Coloradans to date. This testing, which we are ramping up and we'll talk more about later, is giving us key intelligence and data that we are using to coordinate our response. As you know, this situation grows more serious by the day. Here in Colorado, across the United States, and indeed across Europe and much of the world. Scientists and public health experts all are making us gravely aware of the choice that we have and the choices that we need to make to save lives, as well as preserve the livelihood of Coloradans to put food on the table. If we do not do more to slow the spread of the virus, our healthcare system will be overwhelmed, and doctors simply won't be able to treat every patient who needs it that they could otherwise save, given the ability and the equipment to do so. Therefore, we could be forced into a wartime triage situation, having to choose who gets a ventilator or a bed and who doesn't, who lives and who doesn't. That's what's going on in Italy today, and why we need urgent action, individual actions, county actions, and state actions. It's why you only need to shop for groceries once a week and not go out with friends. It's why we all need to increase the physical distance between ourselves and others. The most valuable resource we have is time, and we need to create more of it by slowing down the spread of the virus in Colorado. Time that we can build our healthcare capacity, build beds, secure more personal protective equipment, more ventilators, more life-saving equipment, and better deploy those resources. That has been our challenge and our goal from the very beginning. You know, I ran for governor on a platform of kindergarten for all and lowering healthcare costs and growing our renewable energy economy. I never imagined the severity of these choices that my team and I would have to make over the past few weeks and increasingly in the coming weeks and months. And in many ways, I couldn't have imagined that our nation's response could have been so slow. Like many governors of both parties across the country, I'm furious that as a leader of the free world, we're being forced to close down businesses and restaurants and bars because the United States, unlike South Korea, unlike Taiwan, didn't have enough tests, enough personal protection equipment or ventilators to properly manage care for those who would get this virus. But we're not dwelling on the failures of the past. We're talking about the path forward for the future. Our medical professionals tell me at the height of the virus in Colorado, we might need 7,000 more ventilators than we have today. The administration told us as much when he said the governors were essentially on our own to get medical equipment. Try getting it yourselves was the quote. So based on these developments, it's clear to me and my administration that, like all governors across the country, we as states need to play an unprecedented role in securing our own supply chains of personal protective equipment and ventilators to deal with the virus, and we are, and we will. We need to implement even more dire restrictions to slow the spread of the virus. In past crises, national disasters, pandemics, Americans have looked to our national government to step up. And to be sure, the hardworking men and women of our federal partners, the FEMA region, the state EOC, the U.S. Army Corps of Engineers, the Center for Disease Control and Prevention, are working side by side by our teams and are setting up to work in great collaboration. I've also requested the President approve special funding for our National Guard so we can more fully use our Colorado Guardsmen and a dual status commander that we can integrate into our active Army partners. I've also stated that governors will continue to play an unprecedented role in our response. We are rising to the occasion. We are bringing in the expertise we need to scale our response and leveraging our relationship with elected leaders across the state as well as private industry partners. I want to be clear that our efforts at the state level are robustly bipartisan. Both Republicans and Democrats in our federal delegation have been all hands on deck to support Coloradans. Senator Cory Gardner, who I talk with multiple times every day, has done everything I've asked to help in our response. Our big city mayors, Mayor Hancock, Mayor Coffin, Mayor Suthers, and all mayors, county commissioners, and county health departments. Leaders from all over the geographic map and all over the political map have been equally engaged and supportive of Colorado's response. Legislators from both parties at the state level have launched into action to support Colorado's response, and from the bottom of my heart, I thank them, just as we wish Representative Michelson Janae a speedy recovery from COVID-19. I deeply appreciate this collaboration from the private sector, from members of both parties and no party, from nonprofits, from workers in grocery stores to healthcare workers. Seeing large acts, good acts, large and small, and hashtag doing my part CO really gives me hope about the ingenuity and resilience of the people of Colorado. Today I'm announcing an executive order for all non-critical workplaces to reduce in-person workforces temporarily by 50%. And if you can do it, by more than 50% through telecommuting, through shifting and staggering of schedules. If workplaces can convert to 100% telecommuting, I encourage them to do that. The order directs Colorado employers to implement telework capabilities to the greatest extent possible. When telework is not practical or possible, employers should stagger work schedules to reduce the physical proximity of people doing work and keep employees on payroll as we endure this temporary disruption to our economy together. This executive order doesn't apply to employers that can certify that employees are no closer than 6 feet during any part of the workday, or workers in the critical workplaces that are essential for our emergency response. And that means healthcare operations, critical infrastructure, critical manufacturing, critical retail, critical services, news media, financial institutions, provider of necessities to the economically disadvantaged, construction, defense, public safety, vendors to the public sector and critical services and critical government functions. There will be a detailed public health order that details these today. I want to be clear, for those who are in those critical sectors, we really want to encourage those employers to step up and still make sure that at least 50% of their workforce can telecommute or as a staggered schedule. So no more than 50% is physically working there at the same time. The order affects those who are not in those critical sectors. We are one of those. That is the state. We are actually one of the critical ones, and we are going to lead by example. As an employer of over 30,000 Coloradans, starting tomorrow, we're going to have more than 50% of our non-24-hour employees working from home. Now, what does that mean? We have, by nature of their position, our dedicated prison guards, those who monitor at our youth detention facilities, that have to remain on work on the normal schedule. But for the other functions of state government, we will be modeling by example that even in a critical sector, we will have a majority of our workforce that is telecommuting and not in the buildings at the same time. This allows for greater physical proximity in the workplace. Just as a temporary closure of bars, of restaurants, of salons increases physical distancing, this will help workplaces increase physical distancing so that workers who are critical are at least 6 feet apart to the extent possible. And I want to thank the employees who during these difficult times are of course still coming to work to ensure that people have access to Medicaid and SNAP, staffing the state mental hospital, our correction facilities. Truly those of you who work every day in our critical industries are heroes, and I want to commend you for your sacrifice on behalf of the people of this state. The executive order that will be pending and issued today also contains more guidance for how we can increase our physical distance from one another and succeed in containing the spread of this virus. Coloradans are encouraged to stay home unless you are obtaining the necessary services or supplies, delivering those services and supplies to people who need them, going to or from work, engaging in outdoor recreational activities where you can maintain at least a 6-foot distance from others, or of course caring for a family member, a vulnerable person, a pet in another household, or livestock. And I want to encourage Coloradans that when you're doing those limited activities outside of your home, try to do them as infrequently as possible. Shop once a week for groceries instead of twice. If you're accustomed to jogging 3 or 4 times a week, jog once or twice a week. Try jogging in a different hour when less people are out. If you're a 7 in the morning jogger, wake up early and go at 5. Go a little bit less so that those who are able to can increase our social distance. When you go out once a week to get groceries instead of twice, it will limit your exposure, our exposure, and save lives. Maybe your uncles and aunts, maybe your parents, maybe yours. And if you are at high risk, we advise you not to leave your house for those reasons. People at high risk of severe illness from COVID-19, that could be somebody of any age who has respiratory issues, or somebody who's in their 70s and 80s, or who is sick. You're urged to stay in your residence to the greatest extent possible, unless you need medical care. And I hope that if you know somebody in that category, for your 76-year-old neighbor, please call them and ask, can I pick up groceries for you and leave them at your doorstep? Can I walk your dog? Ask those things because we want to help all those who are most vulnerable avoid exposure to this virus. And if you're experiencing symptoms of COVID-19, if you are experiencing symptoms of illness or have a fever, self-isolate until several days after your symptoms cease or until you have a confirmed negative test result. This is a time where we all need to do our part to protect Coloradans. You know, people have asked, how are you going to enforce this kind of behavior? There is no enforcement authority here. There is a far greater enforcement authority in these matters, and his name is the Grim Reaper. If we don't abide by these simple common sense protocols, you will be jeopardizing lives. It could be your friends, those you love most. It could be your own. But that is the ultimate enforcement of ensuring that we all are doing our individual best to make sure that we have that physical distancing with others to immediately contain the contagion of this virus. And I want to thank all of you who are stepping up already. The hashtag Doing My Part CO social media challenge, those who have donated to the COVID Relief Fund over $4 million, those who have signed up to volunteer at helpcoloradonow.org, and those who have stepped up to donate blood. I have another ask for you today to keep our healthcare workforce, those on the front lines, from getting sick. Because we receive so little from the national stockpile, we need Coloradans to donate any personal protective equipment, masks, gown, gloves to this effort, if possible. You can donate it to your local health department or to the state. And we're seeing a huge outpouring of support. I want to acknowledge this. In the response to this personal protection equipment drive, there was a bipartisan effort led by House Majority Leader Garnett and Minority Leader Patrick Neville, with many members of the state legislature, Project Cure, Colorado Concern, the Denver Broncos, with a drop-off point for personal protective equipment. Thousands of cars came through today to donate that equipment. We've, as a nation, done this before. In world wars, Americans donated scrap metal to defeat the enemy. They had meatless Mondays and wheatless Wednesdays to save food for our troops. That's the spirit that we need to combat this public health crisis and save lives. Creating physical space between you and your others is critical. It's also important to maintain those emotional connections and step up where we can. We also were able to, as an example, waive a regular rule at the Colorado Department of Agriculture that requires in-home visitation for pet fostering to allow anybody to do pet fostering during this crisis. If you can foster some pets, call your local humane society, call your local animal shelter, and express a willingness to do so in this crisis. Animals, pets, your dogs, your cats, they do not spread the virus, to be clear. And creating that physical space between people is important. It's also important to maintain emotional connections with those who are important to you. That means using FaceTime, using video chat. If you have kids, getting on a Google chat and having them talk to their friends. We all need that fellowship now. Spiritual fellowship and social fellowship. We're in this for the long term. Some steps are immediate and urgent and shorter. Other steps will have to be maintained over time. Because without rapid action, the scientists and healthcare professionals who've presented to me say that this crisis could last many months, could last over a year. Now, that's unacceptable, and therefore we know that we cannot expect what's going on tomorrow and next week in terms of distancing to be our new normal. We need to get back to a place where we can enjoy the things that make life worth living. These immediate steps, this social distancing and the way that we're doing this cannot last forever, and we know that. Now, I personally won't stop until we solve these problems. These problems like lack of testing and lack of healthcare capacity. We'll be entrepreneurial and innovative and relentless in our pursuit to change the trajectory of this virus. That's why even in the middle of this crisis, as we're acquiring personal protection equipment, as we're implementing these physical distancing measures, as we've temporarily closed our bars and restaurants and salons and make sure that businesses that are non-critical only have up to half the workforce that are on site, we also are standing up a new division in our Emergency Operations Center to help us innovate our way out of this quagmire that the lack of a coordinated national response has created. We're going to innovate our way to a sustainable, longer-term response. Today, I'm establishing the Innovation Response Team Task Force, which is tasked with several clear objectives. One, developing a statewide system for mass testing and rapid results. Two, developing mobile and other technologies to track the spread of the virus and support those at risk and infected citizens. Third, creating a suite of services for citizens under isolation or quarantine. We know that it is hard. It's hard emotionally, it's hard socially, particularly for the majority of the people who contract this virus who will have minor symptoms. It's hard to remain out of circulation so long. We want to create that suite of services. It might mean something as simple as you need food brought to you so you don't go out. It also might mean that you need Wi-Fi or internet or a way to be productive and contribute during that difficult time. We're going to create, as part of the state response team, a way to maximize compliance with that kind of isolation. And finally, develop locally sourced alternatives that allow us to secure and scale the manufacturing of critical medical supplies to keep our frontline workers safe, our healthcare workers, our grocery workers, and others. These are the priorities of our Innovation Response Team Task Force, which will complement the ordinary work of the EOC in the crisis. This Innovation Task Force is being led on an interim basis by Matt Blomberg, a technology entrepreneur who founded and led Broomfield-based email technology company ReturnPath for 20 years. Sarah Thunberg of GeoSpiza, a company that deals with risk assessment, who will be working with the team and eventually will be the leader of the team. The chief of staff for the innovation team will be Casey Wolf, a senior healthcare policy advisor in the governor's office. Kyle Brown, who works at the Division of Insurance normally, is also a city councilman, will lead our testing team. And Gretchen Hammer will lead our isolation support team. We need all of these functioning together to be able to show that in Colorado, we can successfully respond, as nations have, like South Korea and Taiwan, and have returned to normalcy sooner and reduce the loss of life that have occurred in areas without this kind of coordinated response. And an important component of the innovations team's work is private sector partnerships, which is why I'm appointing Boulder-based venture capitalist Brad Feld as chairman of the Innovation Response Team Private Sector Task Force. Brad has kindly volunteered to spend as much as needed time as necessary to help manage this crisis for Colorado and share that information nationally and globally. Brad will coordinate the corporate and private sector volunteer activities. I understand there's hundreds of volunteers that have stepped up in specific areas: manufacturing, telemedicine, at-home service delivery, tracking. I want to thank as well my friend Noel Ginsberg, who's here. I come out of the tech industry, as many of you know. I've never manufactured anything. Noel manufactures stuff for a living and has worked with manufacturers. He stepped in to help by using his entire network and his companies to start manufacturing personal protective equipment right here in Colorado to keep our healthcare workers, our grocery workers, and all of us safe and to save lives. He's already marshaled 25 academic, business, and industrial leaders that are meeting on a daily basis to attract critical supply chain purchasing needs for our state and standing up personal protection equipment manufacturing that's sustainable here, as well as uniting those supply chains across the world. For example, hand sanitizer, manufactured by Aura Labs with Colorado workers, will be available to first responders and hospitals starting this week. Genesis Plastics in Greeley is gearing up to manufacture plastic face shields. These have a 3D printed technology, open source piece. We're working with 3D printers across the state, and people can do this on a distributed basis. And the manufacturing of the screen part is being rapidly scaled up as we speak in Greeley. Intertech Medical is a manufacturing company making test kits for BioFire that can diagnose the virus within 45 minutes. To have a return to economic productivity for people to put food on the table, to contain the spread of the virus in the medium and long term beyond these short-term steps, which we know are not sustainable, but we have to do, we know that we need to scale up that testing to have that rapid response as well as the isolation services. This is the sort of patriotic response that we need across the public and private sector for Colorado to mount a response to this virus that saves lives. This is Colorado in our toughest days, but it is also Colorado at our best, rising to the occasion to offer what we can do to save the lives of our fellow citizens. If you're a private sector company who has the capability and wants to partner with this team on acquiring or testing or critical constrained medical supplies or technology, sign up at helpcoloradonow.org. There's a section to sign up for individuals who want to volunteer, to donate money to the relief effort, but also for the innovation team, for companies that want to coordinate with our innovation team at the state level. If you have something to offer, these calls have been coming in all different ways, some even through members of the press corps. We now have an organized way for that to occur. Go to helpcoloradonow.org and fill that out. We will have controls in place to ensure that the quality of the equipment and the tests meets the levels of protection that we owe to the people of Colorado, especially for our healthcare workers. And we are working with speed, we are working with urgency, because we know that we are dealing with human lives. We need to do it fast, and we need to do it right. We know other countries have fared better than the United States on being prepared to combat this virus. They've done it through mass testing and isolating those who test positive versus quarantining a whole society, which is unsustainable for a period of time. We're asking people to stay at home now. We're asking, of course, those who are most vulnerable from staying home for any reason except seeking medical treatment. But we know that that is a difficult ask for all of you. And we know that we need to return to as normal a functioning society as we can, as quickly as we can. And that's why we're gearing up our mass testing strategy, so that rather than with a mallet, we act with a finely tuned quarantine on those who have the virus and those who have been exposed to them. Our mass testing strategy relies on the most clinically relevant tests. There's at least two ways to test for COVID-19. One method, known as RT-PCR, tests for the presence of the virus using a nose swab. The other, known as serological tests, test for the body's response to the virus, often with a prick of blood. RT-PCR tests can tell if a person is infected sooner than serological tests, making it more relevant for clinical decision-making, diagnosis, and isolation. There's also proxies for detecting for the virus. When we entered this building, all of us, including myself, everybody here, members of the press corps, your temperature was taken. I hope your temperature was taken. Was your temperature taken? Everybody here. I'm not exempt for that. That is a proxy, because if you have fever, you are contagious. So that doesn't catch at all. Some people are asymptomatic, but we can severely reduce the spread of the virus by implementing those measures, and we have implemented them here, and we will be looking at a larger scale implementation of that, as well as the testing for the virus. Our teams, including the innovation team behind me, are working hard at procuring and coordinating deployment of both kinds of tests, as well as protective equipment and thermometers. We'll continue to partner with the federal government, of course, to get Colorado's fair share of relief, but it's become clear to us that that won't meet our entire need. I'm grateful for the hardworking men and women from the Army Corps of Engineers that arrived this weekend and are deployed to help support our healthcare capacity surge, building, and planning. I'm grateful that the hardworking men and women at FEMA are on top of the job and working with our operations center. But as I've stated before, the states will be taking on an unprecedented burden in changing our paradigm that if we're going to avoid a catastrophic breach of our healthcare system and prevent long-standing economic damage to the state, perhaps including your job, we need to act boldly, swiftly, and immediately, and we are. As you've probably read, projections show that our national response has failed to act early enough, and this virus is likely to be with us for many months. My goal is to ensure that these extreme social distancing measures, this physical distancing of up to 6 feet, will not have to be there for the many months that we have this virus. We're going to do everything that we possible to make sure that we're doing that, but your part is the biggest. It is abiding by these physical and social distancing techniques. It is your decision to only shop for groceries once a month instead of twice. It is your decision to go jogging twice a week instead of 4 times a week. It is your decision to simply get in your car and go to work and return. It's your decision not to meet with a bunch of friends or have parties or socialize or go out for this limited period of time. Because the life you save could be your grandmother's or grandfather's, your mother's or father's, your aunts or uncles, and it could be yours. This is not an ideal response. In the short term, Colorados need to heed this advice and take this situation as gravely and as seriously as healthcare leaders are. But my team is moving as fast as we can to build a Colorado paradigm to ensure that we can look more like South Korea or Taiwan's successful containment strategy and less like the deadly and devastating public health disaster that's crippling Italy right now. And if you haven't seen that, I don't want you to spend hours doting on that and worrying, but Google Italy, coronavirus, hundreds of deaths every day, people that are being triaged in a way where there's simply not enough treatment to save lives. We have to avoid that. We have to physically distance from one another during this time as we gear up towards creating a society that can get as close to normal as possible and can target positive test results with a targeted response rather than this broad guidance across everybody. But right now, we simply don't have the luxury not to ask. The ideal response would have been to have mass testing in place months ago to spot infected people and quarantine them for 14 days, rather than effectively what we're talking about here, which is moving towards quarantine an entire society, reducing the number of contacts that everybody has. But we don't have that luxury. We are where we are. The virus is here in our communities, and we must respond accordingly, and we are doing just that. As long as I'm in this position to lead Colorado's response, I'll continue to take bold steps and do everything in my power to protect our medical workers, limit the severity of the crisis, and save the lives of Coloradans. This is so important that we all take our individual and collective actions to change the trajectory of the spread of this virus in Colorado. I know it's hard. The state runs a lot of different things. We have over 30,000 people. We are going to less than half of the people that aren't in our 24-hour facilities that will be coming to work on Monday. By Tuesday, we expect the private sector, those who are not in critical industries, to be able to get there in our state. So you have better spacing at the workplace, which might mean every third cubicle instead of every cubicle. It might mean there's 2 shifts with people coming in at different times. It might mean that everybody's telecommuting. We would love anybody that can get to 80, 90% telecommuting. Please do that. From your HR department, your executives, your small companies, figure out the best way to do that. It's absolutely critical to do that as much as possible. The same for those in our critical industries. We cannot miss one step in our response in the sectors that are needed. However, we all should think critically about how we can still increase distancing even in those critical sectors. And I want everybody to operationalize and think about how we can best do that for the days and weeks ahead, till we have the scaling of the testing, till we have the isolation protocols, till we have a way in place where we can have a targeted response to this with much more minimal disruptions to our everyday lives, to our jobs, and to our economic activity. That's the goal with the team we're announcing today. That's where we expect to get as a state. In the meantime, please alter your personal activities in a way that reduce your encounters with other people and increase the physical distance for those encounters. Thank you, and I'll be happy to take questions. We'll alternate between in-person questions and telephonic questions. We'll begin with a telephonic question. We'll begin with an in-person question while they're queuing up. Go ahead.
Question. Thanks for your candidness. We've gotten phone calls from viewers, some who sound ill, some sound scared because their doctors are telling them don't come in. They don't have tests. Hospitals are telling them the same thing. We got one call from a single mom of 3 who sounds like she's getting worse and feels like no one will help her.
Yeah. Well, if you need medical care, seek medical care. That is clear. Again, 8 or 9 out of 10 people will not need any additional medical treatment. You will recover in home like you do for the flu. And by the way, that person might have the flu. They might have COVID. They might have strep. I mean, it depends on their symptoms and their clinical diagnoses. They could have anything. But if you need medical care, you get it, right? You call for medical care. If you don't need medical care, if you have a cold or flu, stay out of circulation, right? Avoid encountering others. Have your neighbors, those who are your friends, bring your groceries to your doorstep and leave them. Whatever, again, I hope that those of you are contacting people in your neighborhood in this situation. We don't want to put it upon the person who's sick to do that. If you know a loved one or friend is sick, call them. Just say, what can I do? Can I bring some groceries to your doorstep? Can I, how can I help? Don't panic. Don't worry. This is a lot worse than the regular flu, but there are people that are hospitalized with the flu every year too. And the guidance is the same. If you don't need medical intervention, you isolate, stay at home, and 9 out of 10 chances you'll recover without any medical intervention. If you do need medical assistance, please call, and you will be tested when you're admitted to that facility because they need to know how to isolate you or not. Those tests are sufficient for the clinical need now. They're simply not sufficient for the mass testing need that we need to be able to implement to be able to reduce these very difficult measures that we're asking of people, which are to keep that physical distance, that social distance. We'll go to a telephonic question.
Governor Polis, I didn't hear, but you mentioned agriculture as an essential service. Could you clarify that?
Absolutely. Agriculture, livestock, taking care of pets, those are all essential services. Those remain in place. The guidance for essential services is try again to increase that distance that you have at the workplace. Please try to find a way to go from 1 shift to 2 so that people don't have that physical proximity. Just because you're not under this order doesn't mean you don't have your part to play. And we all want to think critically about how we can telecommute, have multiple shifts, increase that spacing. Of course, agriculture is a critical sector. And I also want to be clear to people, there is a surplus of food in the supply chain. You will have more food if you wait a few days to go to the grocery store than if you go now. Go less often, stock up a little bit, simply go to that grocery store less so less people are there at any given time. We are working, we had a call with the major grocery chains, we're going to do additional work. We're trying to make that a safer environment. But that will be a safer environment several days from now. And again, if you're in that most vulnerable group, if you're in your 70s, in your 80s, you have respiratory issues, please have somebody else, ask somebody else, hopefully somebody else will ask you if they can shop for you and leave that food at your doorstep. We'll take the next question from the room.
Governor, some cities in Colorado have shut down non-essential businesses altogether, and certainly your counterparts in other states have issued these stay-at-home or shelter-in-place orders. Why just do guidance here? I mean, you're asking a lot of people, and driving in here today, there were certainly people in the park interacting with each other. They don't seem to be heeding all these warnings.
It's extremely important that people heed these warnings and listen. No matter what the way that these are being explained to people, there is no civil law enforcement authority that is in a position in any city or state to enforce these. It is not the threat of you being brought to a prison. It is the threat of death to your loved ones and you that needs to ensure that people follow these orders that are absolutely critical, with avoiding groups of 10 or more. Don't, again, use the parks, but only with the social spacing, right? Not gathering with people. Try jogging less. Use them at a different hour than you might use them. I'm hoping that municipalities expand the hours that their parks are available. Our state parks are all open. Again, visit our state parks, but engage in that physical distancing and that spacing. We want to articulate this in the way that is likely to get the broadest popular public participation and buy-in for this physical separation and social distancing. And based on what I know, I think this is it. I think that people need to know the right thing to do. They need to look at the facts and data, and they need to do it. And they need to understand that the consequences are far beyond any that can be doled out by any law enforcement agency in our state. The consequences are very much life and death for your friends, your loved ones, and perhaps even yourself. We'll go to a telephonic question next.
You expressed much frustration with resources from the federal government. Can you speak to whether there are any collaborations on accelerating unemployment benefits?
So there's a lot of things happening federally. I've talked to our members of our federal delegation almost every day. I understand there's a compromise on the Senate on a new bill, but the House might change it a bit. So we are digesting that in real time. I've gotten our negotiating priorities to Senator Gardner when it was in the Senate and Senator Bennett. It moves to the House. I'm going to get our priorities to the members of the House delegation, including FMAP, or matching Medicaid at 12%, including extending unemployment, including cash payments to individuals, including support for health care. There's a lot of priorities that we have. Many of those are bipartisan through the National Governors Association. And of course, we have Colorado-specific priorities that I've communicated to our congressional delegation. We hope and we trust that the federal government will step up on the economic and healthcare side to provide states like ours the resources that we need to get through this. Stephan?
Governor, thank you. I echo, thank you for your candor. On the frustration level, I don't know if I'm reading you wrong. You seem a little more frustrated today. But as far as the federal response, it seems to me you may be on, or should Coloradans think we're like in our own little island right now, and what we need, we're going to have to look within our borders to get this thing moving forward to where you want it.
Well, at this point, it's not productive to do Monday night quarterbacking and said we should have done this a month or 2 or 3 ago. Of course, the federal government should have. With where we are today, we're getting very limited assistance from the federal government. They have sent us, just in the last week, they sent 49,000 N95 masks. That's a significant part of the national supply. To be clear, that's 49,000. Our daily usage is close to 70,000. So we've received less than 1 day's usage in emergency masks from the federal government. So we are working. Noel Ginsburg and others are leading the effort in figuring out what we can make here, when we can make it. On supply chains from China and other countries, we're working on emergency purchase orders and importation orders. So we are doing everything we can to gear up that supply, both with the international supply chain and domestic production, as quickly as we can. And at this point, while anything the federal government can provide us is helpful, we know that we can't count on that to help meet the need. Telephonic question?
Hi, Governor Polis, Fox 9 News. Epidemiologists say that we have a limited window to stay-home orders will be effective. Not talking to healthcare workers today who are begging to issue a stay-home order. Do you risk missing Colorado's window by not issuing that order now?
Well, we are advising everybody to, again, stay. I don't know, everybody can't stay at home. They're going to go to work in the critical industries, if you need medical care, if you need groceries. In all of these places that you're talking about that have issued these, it's my understanding that people are still going to the store for groceries and they are still going to work in the critical industries. What we are doing in Colorado is we're saying for those industries that are not critical, they have to reduce their workplace density starting immediately. And I know it's hard to operationalize that in 24 hours. We're asking them to do that by Tuesday. The state is leading by example. As an employer of 30,000 people, I would never ask the private sector to do that what we as a state can't do. And we're a good example because we do a lot of things. We run a lottery, we process a lot of paper, we put on a state fair. We're like a big conglomerate. We do so many different things. And by tomorrow, less than half of the people that go to work will have to report to their physical location of work, again, with the exception of the prison guards and folks who have to be where they are. That's a big ask. I've got to see what that looks like operationally for the public sector. And we are doing that as a critical service. We're an essential service. The state government is going to keep going through all of this. And that's why I want to go above and beyond what some of those communities have talked about with stay at home, this or that, and say, look, we want even those critical services to find a way to get as many people as you can to telecommute, reduce that workplace density, stagger your hours. We are leading by example as a state. We want as many private sector companies as possible to follow, of course, the ones that are have to follow and the ones that are critical and should do everything that they can to follow. We are also issuing the strongest possible guidance for individuals, including that those most at risk, those are people of high risk of severe illness from COVID-19 and people who are sick, should stay in their residence unless they need medical care. And that's very important. In figuring out how to ensure mass compliance, again, and that's our goal here, we all need to do this. What will inspire people to do this and what will lead people to do this is not fear of a policeman taking you to jail. That's not happening in Chicago, it's not happening in Seattle, it's not happening anywhere. It is fear of the Grim Reaper, an informed fear of the death and devastation that this virus can cause to yourself and your loved ones. Nobody cares more about your loved ones and yourself than you do. And that's why I know that people are acting to remain in their homes except when they absolutely need to go out, why people will be shopping less at grocery stores, while people will be jogging less, and while people will do everything that they can to ensure a space of 6 feet between those and others with whom they interact. Next physical question.
Governor Polis, based on the latest projections that we're hearing from your experts, how many hospital beds and ventilators are we short of what we're likely to need at the peak?
We can get you those specifics. I have a number here that we believe that we're at least 7,000 ventilators short of what we need. We're rapidly scaling up hospital beds. This is the reason we're taking these strong actions around separating people in the workplace, around doing our best to ensure that people remain in their homes except when they are going to work or are engaging in activities that they need to, because we want to give ourselves more time to get the beds, the ventilators, and organizing the healthcare workforce in a way that we can save lives. Telephonic question?
Hi, Governor. I'm curious. I've seen multiple reports from Wall Street analysts saying that in Q2, the entire of the U.S. GDP could decline anywhere between 10 to 24%. Earlier, the President of the St. Louis Federal Reserve suggested it could go as high as a decline of 50%. And I'm wondering, just due to the rapid speed of how the economy has changed over the past couple of days, has anyone in the state government been able to determine just essentially how was the GDP loss, what the amount of loss due to this, due to what's happening with the virus right now, what that's going to look like for the state economy in the quarter and in the future?
So what matters to people, I mean, the GDP is a number you're citing. What matters is, did I lose my job? Do I have a job? Am I able to put food on the table? Am I able to support my family? And for those that have lost their jobs, they are the tip of the spear. It's not your fault. You've worked in food services, you might have worked in retail, you might have worked in travel or hospitality. Times are tough. That's why we need federal direct aid to you. And the focus of our work around the nonprofit assistance is to those most in need. What we can do to reduce the economic disruption, to get those jobs back, is implement these innovative techniques that have worked in South Korea, that have worked in Taiwan, to allow as much of this economic activity as possible, as soon as possible. That day's not tomorrow and it's not next week, but we have the team in place to gear up the testing and the isolation and the way that we can go after this in a targeted way, which will ensure that more people can support themselves and jobs are created and we can turn closer to our normal lives as quickly as possible. Now, macroeconomically, yes, that will mean that the GDP will benefit when we can return to that. But we have to take these steps now to have less than 50% of the people in critical industries going to work by Tuesday. And we know that that's hard. Our HR people need to manage that. Small businesses need to manage that. You will. If you can ensure that no employees are closer than 6 feet from one another during the workday, you can continue. But look at spacing your schedules. Look at telecommuting. We need to do as much of that as we can now, yesterday, so that we can reduce the spread of this virus and reduce the economic damage that entails from it. Physical questions in the back?
We're hearing from our viewers that the unemployment site was down again today. Are there continued issues with this? What's being done about it, and what would you say?
The unemployment site, Colorado UI, is taking tens of thousands of applications successfully, but it can only have the maximum number of transactions per moment has been reached several times. What you need to do is try to go early morning or late night and sign up. Now, people are getting through at all hours of the day, to be clear, but people are also being kicked off the server during the busiest hours of the day. So if you're having trouble, set your alarm for 10 p.m. and it should go through smoothly then. And there are people that are doing it every moment of the day, but it can only handle so many simultaneous transactions. That is, they are working as we speak on increase in the number of simultaneous transactions. They're working through the weekend, OIT, Department of Labor, right now on that, and hope to have demonstrable improvements in the coming days. Telephonic question? We cannot hear you. Speak louder.
Can you hear me?
Yes, speak louder, please.
Yeah, this is Marion, Colorado Politics. Are marijuana dispensaries considered an essential business?
So there'll be in the health guidance will be the information around dispensaries for medical. It's deemed it's a part of a medical treatment for people. For non-medical, they should be using the same kind of curbside delivery that restaurants serving alcohol are doing and others. There's going to be a lot of details. You'll all see that at some point tonight. For industries that are critical, they should do their best immediately to reduce workforce density. For industries that are not on that critical list, they have to, by Tuesday, get to half the workforce density at their workplace to ensure that there's more physical separation between people. In the room? Yes.
Governor, what was your thinking in making your decision not to do shelter in place, especially if that's a permanent decision? You just got have the police as an authority.
What's important is how is sustaining these efforts. What the public health officials, the doctors, the epidemiologists all say is that it doesn't matter as much what you do for a few hours or a day than what you do for weeks of time. You could do, like you do in an active shooter situation, a shelter in place for hours or perhaps a day, but that has very little to no epidemiological value with regard to reducing the spread. You need sustained measures for days and weeks to combat the spread of the virus. Weeks means they need to be endurable. Weeks means we need to do the best we can to make sure that people are able to live with these controls. Weeks means you shop once a week rather than twice a week at their grocery store. Weeks means you jog once or twice a week instead of 3 or 4 times a week. Weeks means your workplace is doing everything they can to have half the number of people come in and the rest telecommute or work on a different schedule. What we do in a period of hours or a day might reach that level of critical importance that there would be action, but the sustained action over time for the weeks that we need until we can build out through this innovation team, as South Korea and Taiwan have done, a way that despite having the virus in your society, and they do, they control it in a targeted way that allows people to earn their livelihood and return to very close to a normal level of activity. We need the mass testing, we need the protective equipment, we need the way to support those in isolation to be able to achieve that. That is a matter of weeks or perhaps months. It's not a matter of many months, and it's certainly not a matter of hours or days. 2 more questions. We'll go to one from the telephone and then one from the room. Telephonic?
There are no more, sir.
Okay, we'll go to in room.
Governor, if this doesn't work to slow the curve, and obviously it'll be a while before we know that, what steps can you take that, in the future?
So here's what we're trying to do on the data side. I think all of you know that I'm very data driven, and this one is hard because the data we have is lagging data. So we have a number of infections, but we think the number of infections is many times higher than that. We have the number of hospitalizations, but that's a number based on people that might have contracted the virus 10 days ago or 12 days ago. Remember, you have both the incubation period as well as the period of time before the conditions become severe enough to merit hospitalization. What we are working on getting is figuring out how much these different social distancing techniques are having impact on reducing the spread of the virus. So we went to, it feels like an eternity ago, but I think it was last Tuesday when bars and in restaurant dining ceased in our state. The epidemiological effect of that is just hitting now. That 1 week from that will be Tuesday. We are just going to start seeing the numbers of how increasing social distancing by not having bars and restaurants. That number will start in the next few days. The impact from the steps we're taking now, reducing workplace density, making sure that our people are staying in their homes except when they need to go out for one of these critical purposes. It'll be a week till we know that. So there are proxies for this. We're looking at metadata around how we can model reductions in pedestrian traffic and traffic so we can plug into the epidemiological models real data about what's working and when with social distancing, because we need to reduce that time. We can't go on making decisions based on where we were 10 days ago. We have to get to the point where we're making decisions based on where we'll be 7 to 10 days from now. And the biggest single piece of this is encouraging as much social distancing, as much physical separation as possible. It means people not leaving your homes except when absolutely necessary. It means that the elderly and people who have respiratory issues don't leave your home at all unless you need medical care. That's your life. No one cares more about that than you. And for those who have a friend or a loved one who is at risk of severe illness from COVID-19, call them. Call them now. Ask what you can do. Can you bring them groceries? What can you do to help them protect their lives for a period of days and weeks? Again, sustained until a period of time that we can have closer to a normal society despite having the virus prevalent among us. It is likely to remain for many, many months. With that, I want to thank, what's that, Maria? Oh, one more telephonic question for the last question.
Hey, Governor, if I heard you correctly, you said the state is short ventilators by about 7,000. Can you elaborate on that? And then separately, can you tell me what concerns you have about hospital facilities to treat patients in the event of a surge?
Yeah, so there are many choke factors. Our medical professionals tell me that the height of the virus, we need approximately 7,000 more ventilators than we have today. That does not mean we're short 7,000 today. That we have enough ventilators for the 60-some people who are hospitalized. I don't have the number of how many are on ventilators. It's a subset of that. But we need to have the pathway to have those ventilators for the peak. So there's the space factor, there's the equipment factor, ventilators, beds, and there's the personnel factor as well. That's why we already acted quickly with regard to reciprocal licensing, meaning we've recognized out-of-state nurses, out-of-state doctors, they can practice here. We've already called for people that are doctors and nurses and paramedics who might be out of the workforce to consider reentering during this emergency. Sign up at helpcoloradonow.org. If you are a healthcare professional that might be in a different job or out of the workforce and can come back for a period of time, contact your prior employer or sign up at the website because, again, we will need you during this highest point of the peak of this surge. This is what the measures we're taking, we hope to put off and delay this peak by taking these actions now, by adopting our entire non-critical workplace to having no more than 50% of people at the office, hopefully significantly less, by asking those in the critical workplace to stagger schedules to the extent possible, and to engage in telecommuting to the extent possible. By modeling that behavior from the state, 30,000 employees, less than half will have to be at their desks on Monday, and yet we're still standing up and supporting all of our state services that are so important for our civil society. And what individuals are doing, what you are doing by only shopping once a week instead of twice, what you are doing by only going out when you absolutely need to, what you are doing to support your neighbor who might be vulnerable by offering to pick up their groceries or bring them food or help them. So these are the critical steps that we're all taking. It's the critical steps that you're taking. It's why we're Colorado strong. It's why this amazing team behind me has left whatever they were doing to say, I want to help Colorado get through this. Thank you. Thank you, Sarah. Thank you, Matt. Thank you, Casey. Thank you, Kyle. Thank you, Noel. Thank you, Gretchen. Thank you for putting your lives on hold to say we are going to make a difference in Colorado, minimizing the loss of life and minimizing the severity and the duration of the economic damage to people's paychecks and jobs from this devastating virus here in our state. And I know that all of you are experiencing inconvenience to do your part as well. And we need you to do that for a period of days and weeks, knowing that this team is going to minimize that disruption to your lives. But it is a small price to pay to not get that haircut, to jog less, to go to the grocery store less. That's all we're asking of you. For those who are first responders, for those who are putting their lives on the line and risk contracting the virus, that's the least that you can do for yourselves, for our state, and for your loved ones. I encourage everybody to increase those physical distances, only leave the house when necessary, and to win this delay that we need in the spread of the virus in Colorado to be able to scale up the targeted response of testing and isolation that has worked in Korea and Taiwan and will work in Colorado in a matter of weeks or a few months. Thank you all for joining us.